Hello medicos. So we are back with the next video. So in this video we are going to discuss about the adductor canal. This adductor canal was discovered first by Dr. Robert Hunter, who was an anatomist. He discovered this adductor canal for this surgery. Okay, so this is the femoral triangle, this is the popliteal fossa, and this is the femoral artery, and this is the popliteal artery. Okay, in surgeries like popliteal artery aneurysm, there is actually huge blood loss, and so to prevent this blood loss, Robert Hunter ligated this femoral artery in the adductor canal so that there is reduced blood loss. Okay, so this is a major, so this is of major clinical relevance, major clinical relevance for popliteal artery aneurysm surgery. Okay, so this adductor canal is, therefore it is also known as Hunter's canal. Okay, Hunter's canal. Adductor canal is also known as Hunter's canal. Okay, or it is also known as intermuscular tunnel. Intermuscular tunnel. So if we define adductor canal is the intermuscular tunnel between these muscles of the anterior compartment and the medial compartment of the thigh. This gives a passage to the femoral artery, femoral vein, and the femoral nerve. Okay, so what is the extent of the adductor canal? Adductor canal begins superiorly, the superior extent or the upper end. It is the femoral triangle, and in the lower end it is the popliteal fossa. Okay, so see this. This is the femoral triangle, this is the femoral triangle, this is the popliteal fossa, and in between, which connects the both of them, this is the adductor canal. Okay, so in the popliteal fossa, it opens as the adductor hiatus. You remember this? This adductor canal opens into the popliteal fossa as adductor hiatus. Hiatus means a hole like structure. Okay, an opening. See, this area is your adductor canal. If we see the cross section, this is the adductor canal, and these are its boundaries. So coming to the boundaries of the adductor canal, the medial wall is formed by the sartorius muscle. The medial wall is formed by the sartorius muscle, the anterolateral wall is formed by the vastus medialis muscle, and the posterior wall is formed by the adductor longus and adductor magnus muscles. Adductor longus and adductor magnus muscle. Adductor longus muscle occupies the upper portion of the adductor canal, upper portion, and adductor magnus occupies the lower portion of the adductor canal. Okay, I hope you're clear with the boundaries. Now coming back to the diagram, see, this is your anteromedial or the medial wall or medial boundary, which is formed by the sartorius muscle. Sartorius muscle. You remember one thing, the sartorius muscle is also known as the altipalpi muscle, which helps an individual to go into the altipalpi motion. Okay. Then medially, medially is the sartorius, anterolaterally it is the vastus medialis muscle, and posteriorly it is the adductor longus muscle. Okay, and in the lower aspect it is the adductor magnus muscle. One more important thing you have to know is this the adductor hiatus is present in the adductor magnus muscle. Adductor hiatus is present in adductor magnus, not in adductor longus. Okay, so this is not the end. The medial wall also comprises of this subsartorial plexus. This is known as subsartorial plexus of nerves. Okay, subsartorial plexus, and this intermuscular fascia. Okay, subsartorial fascia also. So here you can also add plus subsartorial plexus plus subsartorial fascia. Okay, so in this diagram we are going to highlight now. See, this is your femoral triangle, this is your adductor canal, and at the back we have the popliteal fossa. Okay, now coming to the contents of the popliteal fossa. The contents of the popliteal fossa, the contents of the adductor canal, these are the femoral artery, the femoral vein, then descending genicular artery. See, this is the femoral artery, this is the femoral artery. Coming back to the diagram, femoral artery, this is the femoral vein, this is the nerve to vastus medialis, nerve to vastus medialis, this is femoral nerve, and this two. Okay, these two are anterior and posterior divisions of the obturator nerve. Anterior and posterior divisions of the obturator nerve. Okay, so what are the contents? Femoral artery, femoral vein, nerve to vastus medialis, femoral nerve, anterior and posterior divisions, anterior and posterior divisions of obturator nerve, and the descending genicular artery. There is another artery known as the descending genicular artery, which is a branch of the femoral artery. Okay, I hope you're clear. Yeah. So coming to the arrangements of the contents inside the adductor canal. So we divide the adductor canal in the upper 1/3, the middle 1/3, and the lower 1/3. So keeping this as the medial side and this as the lateral side, in the upper 1/3 we find this one, this arrangement. Okay, in the upper 1/3 we find in the upper 1/3 we find NAV, meaning we have nerve laterally, that is femoral nerve laterally, and femoral vein medially. Now in the middle 1/3 the nerve comes on top of the femoral artery, and the artery is on top of the femoral vein. So it is like this, NAV. Nerve is most superficial, and vein is most deep. Okay, and in the lower 1/3 it is just the opposite of the upper 1/3, that is VAN, which means vein, femoral vein, which is most lateral, and femoral nerve, which is most medial. Okay, coming to the clinical correlations of the adductor canal. I told you adductor canal is used for the ligature of femoral artery during surgeries. So writing it, during surgeries of lower limb, especially we talk about this, especially popliteal artery aneurysm, this femoral artery is ligated at the adductor canal. The adductor canal. But why? I told you to reduce for reduction of blood loss during surgery. Okay, I hope you're clear with it. So we are done and dusted with the adductor canal. In the next video we are going to start the medial side of the thigh, and if you like my video, please do like and subscribe my channel. Thank you for being with me. Bye bye.